Edge Benefits podcast for the host, Tom Quigley of ClaimLinx. Tom, what's going on? How are you? And we're going to talk about some 2026 stuff. How are you?
It's kind of spooky on today. Halloween. Yes, I'm doing good.
Good. I'm ready for Halloween. I'm ready for this weekend. I'm ready for November. Tomorrow. Today's topic's health insurance costs surge in 2026. Why employers can't afford the status quo. Reports are projecting nearly a 9% rise in employee healthcare costs for 2026. What is driving this dramatic increase? We've talked about it, but I want to continue to ask you this question.
Well, as Gordon Gekko said in Wall Street, the original one, greed is good. It's all about greed. All about the Benjamins. That's the companies, got the insurance companies who are stock companies. You got the pharmaceuticals, ditto. You got the hospital administrators. You got the government trying to be involved. They're corrupt. They're all corrupt. And what happens is corrupt people allow corrupt things to happen. So what you have to do is you have to take the system, understand the laws. The insurance agents and insurance companies also corrupt. And what you do is you take advantage of the tax breaks and the laws, and you lower your costs dramatically and you improve the benefits for employees. Obviously, you can't continue to do it the same way because it makes no sense, and it hasn't since 2099. And you continue to try to do the same things, putting a round peg in a square hole, and now the round peg can't even fit into the square hole. You can't even jam it in. Yeah, it's not so high. Poor bastards. But what I do is I save people money. I win the game for them every year.
Yeah, you do. And that's the key component. But 9%, that's going to kill some businesses. 9%?
Well, if they want to continue buying it the same way, yeah. I'm seeing 30-40% rate increases routinely right now. Yeah, people just don't get it. I mean, they have to change. You have to, do things differently. I put on LinkedIn all the time, hey, insurance agents, why don't you come on my show, podcast, and cutting edge benefits and explain how you save your clients money? No, I hear crickets.
Do you want me to set them up and put them on with you and I?
Yeah, I think it'd be kind of fun. I don't know if it could be PG though.
How long do they stay out? I've done this before in my radio career. Trust me. Where I surprise somebody and, I'm a guest on this show. And then guess who else is on who's calling in? So-and-so. You're like, I forget which.
Like a husband, wife, and the wife's cheating on the husband, and you bring the boyfriend on the show. Nice.
No, we got to go Jerry. All right, next question.
Jerry's gone. Next one.
All right. How will this spike in premiums and pharmacy expenses specifically impact small and mid-sized businesses?
Same deal. It's built into the costs. You just continue to pay more and more. And you get less and less, unless you take control of all of it. There's ways to reduce your pharmaceutical costs dramatically, but you have to do it differently.
Many employers will try to offset costs by shifting more burden to employees. Why is that a short-term fix with long-term consequences?
Well, if your objective is to provide benefits that are better than competition and retain and attract employees, that's a method of disaster.
It sounds like a disaster.
Going out to sea and just going, hey, we don't need the bottom of the boat. Screw it. Take it out and go down real fast.
I don't understand why they do that, because all it's going to do is tick off the employee so it decides, I'm not going to manage AI for you. All right, next one. What innovative funding models or plan designs can help companies control costs without sacrificing coverage?
What, AI?
No, not with AI, with you.
Oh, that's well, we're going out, showing them how to purchase the health insurance and then how to provide the benefits underneath. So it's a very simple process, but it's made out to be hard. It's not. It's easy. The whole system is. It's just right now. It's like Christmas time every day. I wake up and I'm like, how many people are going to listen to me today?
And do they?
The ones that do, man, it's Christmas for them. I mean, think about it. If I go into a company at 25 people and I save them 100,000, so they get 10,000 extra, and let's say 9,000 something extra in their account every month, they're happy as blank. I mean, their health insurance is now has turned from being a huge liability to an asset. They offer their employees on their balance sheet better benefits, and the employer gets better. They increase the value of their company, and they, it's equivalent to like $1 million sale in some cases, sometimes 2, sometimes 20. It's crazy. And they sit there. I mean, they should be singing zippity doo dah after they make it.
Zip. I don't want to have you sing that or me sing it. How does ClaimLinx simple option solution position businesses to stay ahead of the 2026 cost curve?
Taking advantage of the tax laws again, setting them up, understanding that, hey, when some of these carriers come back and say they're going to raise rates 120% or whatever they are on these level funded health plans, that's just a game, and you got to beat them at their own. That's what we did.
So in November, is this when everyone's looking to renew?
They're getting their good news reports this week and next week and the following week for when rates are going up in January. HR directors are crying. They don't know. I'm sitting there going, you got to change. You got to do something. And the owners are sitting there. They're mad. They just surrendered somebody. And I'm sitting there going, are you going to be smart this year or aren't you? And I mean, the rates, are what they are. And the insurance agents are getting raises if you don't do anything. So they're sitting there going, how many people can we sucker into taking these rate increases, man? We're going to have to come up with some good ones this year. So they sit around their tables have a little meeting with all the agents. So what do you think we can do? How many people do you think we can sucker into taking the rate increases? We're so good to them by bringing them to football games and stuff. And they'd probably take on this 9-10% increase. Or better yet, I saw one yesterday, this funny. So the agents are like, oh yeah, they got a 6% decrease. But they were getting a 20% increase on current health. So what they did is they stripped the benefits. So now the employees went from like a $500 deductible to a $3,000, and they think they're heroes, like Hogan. It's like, wait a minute, you gave them a decrease, but you stripped their benefits. Now they don't even have co-pays. My God. But here, and I said, what? Do you guys want to save like 50% off of what you were paying before all this garbage? And they were like, well, what? I said, lots of people.
And the best place to go is go to claimlinx.com and schedule a call with Tom today or his team, and they're going to do you right. That's for sure, Tom.
Absolutely.
All right. All right. You're listening and watching the special simulcast of the Neil Haley Show and the Cutting Edge Fits podcast. Take care.